Hi, I'll be your nurse for today. I'm Nurse Peace, and today we'll be performing a head-to-toe assessment. Before we begin, I'm going to perform my hand hygiene. Okay. Can you tell me your name and your date of birth?
I'm Jessie, and I was born on June 28, 2010.
Okay. Then, after assessing my patient's name, can you tell me, do you have any pain on a scale of 0 to 10, 0 being the lowest and 10 being the highest? If you have any pain, what range will we put in the pain? Okay, my patient does not have any pain. All right, before I begin, I'll ensure privacy. I'll provide privacy. If my patient has any pain, I'll run a pain assessment. I'll check out the medication that the patient has to do. I'll perform my PQORSTU for the patient before beginning the procedure. So before I begin, I'll provide privacy to ensure to protect my patient dignity. The beginning of this assessment, we are going to start with the neurological assessment. For neurological assessment, can you tell me what date it is today? And can you also tell me what your name is? Okay? Can you tell me what date it is?
It is June 25th.
Okay. My patient is conscious of time, place, and also person because my patient was able to tell me his name. Okay, now we are going to move down to the assessment of the cranial nerves. For the assessment of the cranial nerves, we are going to be assessing the third cranial nerves, the fourth cranial nerves, the sixth cranial nerves, and the seventh cranial nerves. This third cranial nerves include the oculomotor, the trochlear nerves, the abducens, and also the facial nerves. To assess these cranial nerves, I'm going to be asking you to follow some instructions. Can you please sit up for me? Thank you. Okay, use one hand and cover one eye. Okay, what number is this?
1,
Okay,
2,
okay,
3,
okay,
4.
okay. Okay, my patient is able to follow all my hand movements, so the ocular motor nerves is very well. And I'm going to also assess for the second eye. Can you cover?
1, 2, 3, 4, 5.
Okay. After assessing that, I'm going to be asking my patient to assess the facial nerve. Can you smile? Okay, the smile is evenly distributed. That means the all facial nerves are working. Now we are going to be assessing for the pupilla, which includes the pupils. We check if it is equal, if it is round, if it's also reactive to light. Okay.
Yes.
The pupils are round, they are equal, and it's also reactive to light. Thank you. Pupils are round and equal and it's reactive to light. Thank you. My patient is able to follow commands. The pupils are round, they are equal, they are very well reactive to light. There's no any abnormal findings that have been discovered now. Now we are going to move down to the respiratory assessment. For the respiratory assessment on inspection, the chest wall is expanding and they are also equal while the patient is breathing. And my patient is not finding it difficult to breathe. My patient is not breathing with any accessory muscles. So now we are going to move down to auscultation. For the auscultation, I will auscultate anteriorly 5 landmarks and posteriorly I'll be auscultating 9 landmarks. For the posterior auscultation, I'll begin to auscultate for the long sounds. Okay. Firstly, I will locate the okay. Okay. The normal the lungs are clear. I will listen and posteriorly. To please, can you come forward? Let me listen posteriorly. Please, can you come forward? Okay, the long sound are clear. Okay, now we are going to be moving down to the cardiovascular assessment. Please, can you rest your back? For the cardiovascular assessment, I'll be listening to the heart sound to listen for the and then get the whole valve sound. Firstly, we are going to begin with the aortic valve, which is found on the right intercost on the second intercostal space at the right sternal border. Okay. 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 Now I'll be listening for the pulmonic on the second intercostal space of the left sternal border. Then the head on the third intercostal space of the left sternal border. And then the tricuspid on the fifth intercostal space of the left sternal border, where I will also listen to the mitral, also on the fifth intercostal space of the medial border. I will also listen for the apical pulse. Normal heart sound was heard, the S1 and the S2 was heard. And now I'm going to be moving for the abdominal assessment. For the abdominal assessment, I'll find out from my patient when last did you have a bowel movement? When last did you void? Have you had a bowel movement of recent? When last did you void? And then I will check also the skin to assess also I'll check the inspect the abdomen if the skin are evenly distributed. I'll also check my patient's skin is color is same for ethnicity, so the patient has a good color distribution, same for ethnicity. Then I'm also going to now go back listen for the abdominal sound after inspection. I will listen right from the right lower quadrant to the right upper quadrant to the left upper quadrant and then the left lower quadrant. Okay. On auscultation, normal bowel sounds were heard, and then I'm going to palpate now. On palpation, no any mass was seen. There is no any fluid abnormal mass collection on the abdomen. Now I'm going to be moving to the extremities. Okay, firstly, I'll check for the carotid. I'll check for the capillary refill. Can you give me your finger? Okay, capillary refill returns back to after 2 seconds. Under 2 seconds, capillary refill is present, and then I will check for the temperature. Is warm to touch. Then I will also assess for the radial pulse. Radial pulse is present bilaterally. Then muscle strength. Muscle strength is present. Then I'm going to move down to the feet. Also, I'll check for the I have to pull off your socks to check for the capillary refill and also the capillary refill is present. Then I'll check for the pulse. The tibia plus pulse is present, and then dorsal pedalis is also present. Can you push back? Okay, can you resist?
Yes.
Okay. All right. right. The dorsal feet are present. The strength on the feet is present. Also, my patient is having good pulse is present, and then on assessment, the head to toe assessment has been completed. There's no any abnormalities that can be seen with my client. Thank you very much for your cooperation. 360.